Dr. Stanley's 4 S's for surgical success. So you've just had a surgery and you want to know what you can do to help the healing process. Well, there's 4 things that you don't want to do, which I call the 4 S's. Let's go through them. The first one is no smoking. Okay? Smoking is the first one we're going to talk about because it's so very, very important. Smoking is terrible for wound healing. It's a vasoconstrictor, which means it cuts down on the good stuff that needs to flow to the site to heal properly. So if you are having a fire and you want to put the fire out, you want a hose that pours a lot of water on the fire, right? If you have a hose that you're constricting, you don't put the fire out. In this case, we want a lot of blood to go to the site because it carries all the mediators necessary for proper healing. And smoking gets in the way of that. It also is chemically toxic, right? It has carbon monoxide in it. Carbon monoxide gets in the way of hemoglobin attachment. It blocks oxygen up to 6 hours when it attaches to the hemoglobin, which prevents proper wound healing. So you can see that if we are smoking prior to, during, and after an oral surgery, you can really, really end up with a lot of complications if you're smoking. The second S is no straws. Okay? When you use a straw, the straw will create a vacuum. When you suck on the straw, it creates a vacuum, and that vacuum can pull the clot out of the socket. If the clot comes out of the socket, it's affectionately known as a dry socket. So some of you who are watching right now are going, oh my God, I had a dry socket in high school when I had my wisdom tooth taken out. And you'll remember that incident. But what happens is the clot is pulled from the socket, and subsequently it doesn't bleed very well, because the initial bleeding process is already over. The site has clotted, the clot is removed, and you don't get a good bleeding a secondary time. Without the good bleeding, you don't get a good clot. If you don't get a good clot, the bone is exposed, and if the bone is exposed, it hurts. So you want to stay away from straws. Now, this is a little tricky because oftentimes we say colder foods are better than warm foods because they're vasoconstrictors. So we say, go get a Frosty or a smoothie. And a lot of times we drink a Frosty or smoothie through a straw. But in this case, you can't use a straw. You can use a spoon. Okay, so just spoon it or just use the cup itself if you've got a big gulp. Okay, so just go for it without it at all. The next thing is there's no spitting. So the number 3 is no spitting. The same thing with spitting. When you go to do spitting, if you have a loose particle, maybe a bone graft particle or something's loose in the mouth and you feel compelled to remove it, if you try to do the spitting action, it creates a vacuum. So not only that, but it's a strange motion on the mouth, which can disturb the wound. It can disturb the sutures. It can make a lot of problems. So no spitting. Well, what do? You just drool. So what I tell my patients is you go over the sink and you go, blah. Okay, you just go blah and wipe it off, and that's it. Okay, so it doesn't mean you can't get something out of your mouth if there's a foreign body in there and you need to get rid of it. That's fine. It's just that you want to lean over the sink and wipe it off. The 4th S is no swishing vigorously. After many oral surgery processes, your dentist is likely going to prescribe you an oral antimicrobial rinse, maybe some chlorhexidine, maybe it will be some CTX4, something like that. Well, how do we rinse? Well, if you've watched the television and you've seen like the Listerine commercials, they agitate, right? They rinse really aggressively. They agitate like a washing machine. And that agitation will disturb the soft tissues that are growing in the mouth. And if you disturb the wound before it's done healing, you will set yourself backwards. So instead of helping yourself with warm saltwater rinses or Listerine or CTX4 or something along those lines, you're actually hurting yourself. So it doesn't mean that you should stop using the rinse. What it means is you should use the rinse differently. Let me explain how I recommend using the rinse. The way I suggest using the rinse is to place it in your mouth, think of it as your favorite color, and rinse the inside of your mouth with paint. So all you have to do is move to the left, move to the right, move to the front, to the back. As long as the medicament flows over the surface, it will do its job. You don't have to swish vigorously. So just as your doctor has prescribed, how they've told you to use it, whether it's after every meal or twice a day. Use it that way, but don't swish vigorously. So, in conclusion, these 4 S's really can keep you out of trouble when you're after any oral surgery procedure. So remember, no spitting, no smoking, no sucking on a straw, and no swishing vigorously. Those are the 4 S's for surgical success. This has been another episode of Implants Made Simple. I'm Dr. Robert Stanley, the Smile Engineer. Follow for more.